Okay, so we're officially streaming, and I just want to make sure we're good in the community. Okay, here. Okay, so we're officially streaming on YouTube and in the community. Okay.
Ready?
Great. Yep, we already have one question already. It's exciting.
Great.
I just want to make sure it's not, for some reason it's not like embedding correct here. Let me just try to fix this really quickly.
Okay.
I think
We're just about to get started, everyone. Those of you who are watching, this is our first inaugural office hours for Paloma Health, where we do Q&As with various people in the thyroid world, helping you understand and get information and get up to speed on topics that can help you feel well and live well. So we're excited to get started. Alex is from Paloma Health, is our producer today, and she's getting things all figured out on the tech end.
Okay. Alrighty, yeah, go ahead and get started, Mary.
Okay,
I'm going to go ahead and mute.
Super. Thanks, Alex. Hi, everyone. I'm Mary Shomon, and I am a consultant and advisor to Paloma Health. And I have been a thyroid advocate for almost 30 years and a thyroid patient for a few more years than that. And I'm really excited to bring you today our first inaugural office hours. And what office hours is going to be is a regular monthly opportunity for you to get a chance to ask questions of a variety of different people that Paloma is going to be making available to you. Paloma doctors, nutritionists, other sorts of experts. And so bookmark it, keep track of it, make sure you're on our newsletter list so that you can get notifications of when we have these upcoming office hours, because it's your chance to get the floor and have an opportunity to ask your questions. So with that in mind, start feeding your questions in. If you've got any questions, please share them. Let us know what's going on in your world so that we can try to help answer you. Now, one thing before I tell you a little bit more about Paloma is just to make sure you all understand, I am not a doctor or a healthcare practitioner. I am a patient advocate and an educator. So I don't do medical advice. I do medical education. And my job is to help fast forward you up the learning curve so that you know the kinds of questions to ask, that you understand what's going on and how you can approach your doctors and your healthcare providers so that you are able to be empowered and advocate for yourself. In future issues of our wonderful program, we're going to have doctors who can give you actual medical information, etc. I'm here today to be an advocate and help you get up to speed. For those of you who aren't familiar with Paloma, if this is your first opportunity to get to know Paloma a little bit, you may not know we are a medical practice dedicated to treating hypothyroidism, to the diagnosis, treatment, and management of a healthy, happy, wonderful, symptom-free life with hypothyroidism. Sounds good, right? Paloma has multiple different facets in their ability to provide this. First of all, we have an incredible team of doctors around the country who provide virtual care. So that's right, from the comfort of your chair in your living room, like I am, or your cell phone at your office, wherever you are, you can do virtual visits with your Paloma practitioners. So this is an incredible opportunity. Also, these are some of the best thyroid specific practitioners in the country. They know hypothyroidism in and out. This is what they do, and they do it extremely well. Paloma also has an incredible app which helps you understand the autoimmune protocol diet, which studies have shown can really help alleviate many of the symptoms associated with residual hypothyroidism. Even after you're treated and you're still suffering with symptoms, this can help relieve those. It helps with a lot of the issues of autoimmunity and inflammation in those of us who have Hashimotos as the cause of our hypothyroidism, and it can help with weight loss. So the AIP diet plan is embedded into our incredible app, which is free. And the app also has information, articles, access to blogs, a symptom tracker. It is so filled with features for thyroid patients, and it is the most robust and incredible app out there for people with hypothyroidism. Paloma also has one of my favorite features, the home thyroid blood test kit. So all you need to do is order up a kit. You take it at home, you shake your hands, put a little alcohol on your finger, take a blood spot, which doesn't hurt. It's not like getting an arm stick at the lab. And you put some drops of blood on a card, mail it back in, and in a few days to a week, you have blood test results coming back to you securely. So it's incredible. It tests TSH, free T4, free T3, and TPO, thyroid peroxidase antibodies. Plus, you can add on vitamin D and reverse T3 if you want to. So this is a very easy, comfortable, convenient, and affordable way and painless way to get your thyroid blood tests as often as you need them. Paloma also has nutritionists on staff who can help you put together a thyroid friendly nutrition plan and talk to you about your supplements. And speaking of supplements, Paloma has a customized thyroid supplement available, which is incredible. It combines all of the nutrients that you really need for good thyroid function all in one place. We have an incredible blog with just hundreds and hundreds of amazing articles covering every kind of facet of hypothyroidism that you might have questions about. And there's also our community, where some of you are watching today, where we have ongoing threads and conversations where people are sharing their stories, their successes, their frustrations, getting advice, sharing the latest news, research. So it's a really great place to connect with other thyroid patients to get to know what's going on. So as you can see, this is a little bit different than, going to your local doctor, having them draw your TSH test and sending you home with your prescription and telling you to come back in a year. This is a complete comprehensive care program for people with hypothyroidism, and the results are there. We're seeing the numbers and the statistics. The patients are reporting that they are feeling better. Their levels are getting under control numerically, but most importantly, their symptoms are getting under control. They're feeling significantly better. Plus, they have doctors who listen, who care, and who are their partners for wellness. So that gives you a bit of an overview of what Paloma is all about. And so today I'm inviting you to put in your questions into our chat box, and I'm going to go ahead and get started with the questions, and we'll see what we got going on. So let's see. We have first question is a 62-year-old man who had a total thyroidectomy since 2012. I'm always having difficulty getting the right dose combination for Cytomel and Synthroid. One time recently, I got a shot of cortisone for a shoulder problem, and it made me feel better, more energetic, less chest pain for a couple months, and helped with, I think, my thyroid dosages. How do you feel about using cortisone topical cream as a source of cortisol? I hear it's not good to take regular cortisone shots. I did saliva cortisol testing, and though I'm very low in the morning and throughout the day, this makes me think I may also have adrenaline or adrenal insufficiency. My free T3 is usually 2.9 or 3, and my free T4 is a 1.2 to 1.1. Okay, so this is a lot to unpack, but let's give it a try. First of all, you're not the only person who got a cortisone shot or went on steroid drugs and then reported feeling a lot better. That's one of the benefits when you first start a cortisone regimen, whether it's by injection or oral. It can make you feel really energetic and fired up because it's really supporting the adrenals in that period. It's also reducing inflammation for a short amount of time while you're on that treatment. The question is that you're asking though is, should I be doing things like on a do-it-yourself basis using cortisone cream over the counter? We're never going to recommend that because that is, you're not really going to know what you're doing, how you're testing it, and addressing the issue at the root cause. If you've had saliva cortisol testing that showed you being low in the morning and low throughout the day, that could suggest some degree of adrenal fatigue or adrenal insufficiency. And my suggestion is that you talk with a doctor, and it may be a Paloma doctor. I don't know if you're with Paloma or not, but your Paloma doctor may be able to work through this with you, but to talk about a little bit more about what's going on with your adrenals and to focus on things that you can do to support your adrenals from the inside. Cortisone and cortisol are really band-aids for the adrenals. If your adrenals are not doing what they need to be doing, we need to be looking at the sources of stress in the body, whether that's physical stress, emotional stress, chronic infections, nutritional deficiencies, lack of sleep. You wouldn't believe how many people with adrenal fatigue aren't sleeping 7 or 8 hours a night. They're getting 4 and 5 hours. And of course, their adrenals are going to be suppressed and not working as well. So we need to get you with the right person to really work with your adrenal function and support it. All the doctors that I know that do integrative work with adrenals, cortisol or hydrocortisone treatment is the last resort. And it's only for those situations that don't respond to nutrition, lifestyle intervention, and vitamin therapy. So that would be my recommendation regarding that. As for your free T3 at 2.9 or 3 and the free T4, you might benefit from a conversation with your doctor about whether or not you are optimal, because your levels aren't quite optimal by some people's definitions. Free T3 is the active thyroid hormone at the cellular level. T4 is a storage hormone. It's a prohormone. It has to turn into T3 to be usable by the body. So your T4 level is fine, but your T3 level is not up in the range where about the midpoint of the reference range or a little higher, which is where a lot of people seem to feel their best. So you might be somebody who, if you're not on it already, could benefit from a little bit of T3 in your combination therapy, T4, T3 therapy, or a different change in your dosage of your levothyroxine, if that's what you're taking. Bottom line, though, that's a conversation to have with your doctor and say, look, can we get my levels a little more optimal? Because I'm having some issues. I've got some symptoms. Maybe my thyroid. It may also be the adrenals. And keep in mind, they work together. If the adrenals aren't working well, the thyroid is being pushed harder. If the thyroid's not working well, the adrenals keep having to work harder. So both of them, we need to support both in order to feel well. So good question. I really liked that one. Okay. We have another question. Is there a specific test for pituitary dysfunction? That's a little out of my area, but I can tell you there is a test. I believe it's called the ACTH test. That can test for pituitary dysfunction, but it's really going to be looking more at pituitary hormones. And my sense is that the question there may be, is there some way to test whether your pituitary is messed up and not doing what it needs to do as far as issuing TSH, releasing TSH, etc. That's a little bit harder to tease out, but there are some challenge tests, but they're very difficult to find and very expensive to test whether or not you're releasing TSH in a proper way. So very few people are using it. I believe it's called the TRH test. It's different than the TSH test. But in any case, there's plenty of ways to test pituitary. They can evaluate oftentimes there are imaging tests done for pituitary. There are various blood tests and this ACTH test as well. So there are tests to check for pituitary dysfunction, but to tease out what's going on with the thyroid specifically related to the pituitary is much more complicated, and it's quite rare as far as a test is concerned. Okay, so we got another question here. How do you feel about organic tofu with hypothyroidism? But I know regular soy can be bad with how they process it, but interested in it from the thyroid perspective. The question with soy is, first of all, if you're eating soy, it needs to be organic and non-GMO. Okay, so we don't want to have GMO, genetically modified soy, because it's just not a good idea. The issue with soy is that we need to do it in moderation. Every nutritionist and integrative doctor I know said there's no reason to never eat soy unless you're allergic or super sensitive to it. But you need to eat it in moderation in the way that the Asian diet incorporates it, which means it's a condiment. It's not a primary protein. So if you look at the way Asians eat soy, they have miso soup with a few cubes of tofu in it, or they put a little bit of tofu into a stir fry, 90% vegetables, 10% tofu. The unfortunate thing that's happened in the United States is we've decided if a little bit of something is good, a whole lot of it must be better. So now we have tofu burgers, we have soy burgers, soy shakes, soy milk, soy bars, soy ice cream, soy supplements, and people can end up taking incredibly high quantities of soy. And at those levels, soy starts to act like a hormonal drug rather than as a nutritional food. So my feeling is if you like organic tofu, have some and incorporate it into your diet, but as a condiment, not as a primary protein. And that should help you avoid any particular implications of the soy getting in the middle of slowing down your thyroid or affecting your thyroid absorption of your thyroid medication. Just be moderate and don't go crazy and say, okay, I'm going to have soy smoothie for breakfast and a soy shake and a soy latte. And then I'm going to have a soy burger. And then I'm going to eat soy protein bars as snacks and soy yogurt and soy for dinner. I mean, when we do that, that's when we start to see people reporting that there's some issues with their thyroid. All right. Why is there so little research on healing the autoimmune aspect of Hashimoto's when it's so prevalent? I've worked with so many doctors who just prescribe TSH and call it a day. Here, the issue with autoimmune and the thyroid regular issue is that autoimmunity encompasses a whole lot of conditions apart from thyroid disease. It covers rheumatoid arthritis, multiple sclerosis, psoriasis, pernicious anemia. There's so many different conditions that fall into the autoimmune category. So thyroid is just one of them. It happens to be one of the more predominant ones, more common ones, but it's also, by doctor standards, one of the least debilitating. I mean, you have rheumatoid arthritis, you're at risk of permanent joint damage, and in some cases, such disability that you can't hold things or walk properly, or you're going to be in chronic, constant pain. Multiple sclerosis can put people in wheelchairs. So some of these conditions are extremely debilitating and life-changing. I'm not trying to downplay what thyroid is because it can be very debilitating and life-changing for us. But for doctors, they're looking for those dramatic symptoms. So the implications of the autoimmunity in Hashimoto's have not really been focused on as much. And in my opinion, it's because for doctors, the fix is simple. It's okay, we're not going to worry about what made you hypothyroid. We're just going to get rid of your hypothyroidism by giving you thyroid hormone replacement medication like a Synthroid or a natural thyroid or a combination T4, T3. So the focus hasn't really been on what can we do about the autoimmunity, in part because they don't really know that much about it. The study of nutritional implications and genomics and all of these things and the gut impact on the immune system, it's all fairly in its infancy. And when they don't even exactly understand exactly why some people become autoimmune, I mean, you can have two twins, identical twins, they both are carrying genetic propensity to autoimmune disease. One develops Hashimoto's, the other one doesn't. What is the mechanism that makes one gene turn on and start the process, and for somebody else it doesn't? They're still studying this, but the good news is they are studying it. There are lots and lots of studies into various facets of autoimmunity going on, just as there are many studies going on about hypothyroidism and some about Hashimoto's. But have they gotten to the point where they can reasonably conclude this is what we can do about autoimmunity and release it as official guidelines from the official associations so that the standard doctors around America are going to be able to do that? We're a long way away from that. That's why I love the Paloma approach, because we're doing vetted approaches to hypothyroidism treatment, but we're bringing in things like the nutritional component, the supplements, the lifestyle issues, the importance of all of these lifestyle components, dietary changes, and all of the different factors, support, community, understanding of information, empowerment. All these things contribute to the overall experience and can help with autoimmunity. For example, again, we talked about the AIP diet a little bit earlier. For some people, that can dramatically lower antibodies or even put them into remission, which essentially means their autoimmune disease is not visible. It's not happening at that point. So I guess the question is, why is there so little research? There's a lot of reasons for it, and it's not a good thing, but it's improving. It's getting better, but it's slow. Medicine operates very slowly in many cases, And so, but we can keep asking for it. I'm not saying we shouldn't be agitating for this kind of research and understanding, but in the meantime, work with the doctors who get it and who incorporate the medical component in with the nutritional and lifestyle component. Okay, we have somebody that wants to know, I'd like to know how often you recommend checking TSH and lab levels. This really is a question that you need to work out with your doctor, because if you're in the middle of changing medications, for example, somebody that's going on natural thyroid from Synthroid or levothyroxine, you're going to be checking every 6 to 8 weeks until your levels stabilize. If you're someone who's pregnant, for example, you're going to be checking frequently. I checked every month when I was pregnant. I had my blood, I probably had 8, 9 blood tests during my pregnancy with my thyroid to make sure that it was very carefully controlled. Other people who've been on a dose and stable and feeling fine, they might get their blood checked every 6 months, sometimes even once a year if they have been really consistently doing well and feeling well. I also will say to people, look, if you have weird symptoms or things that relate to your thyroid, get in there and get tested right away. So some years, for example, in my case, I've had 2 tests in a year. Other years I've had 6, depending on my symptoms going up and down, things changing, weight fluctuated, that can create a change in your dosage needs or symptoms. So it really is going to be depending on what is going on with you and your unique circumstance. But at minimum, all the doctors I know recommend at least twice a year. And in many cases, quarterly is probably a good guideline for people until you have really got some time under your belt, stable at a certain level with optimal symptom relief and optimal thyroid function. Okay. Is it abnormal for someone with Hashimoto's to have their TSH go from 2.8 to 1.4 within 3 months and fluctuate from high to low? That's not unusual. It's absolutely not unusual, because that is, I mean, it sounds dramatic to us, but to go from 2.8 to 1.4, it could be a difference in the time of when you had your test done, because TSH levels are different in the morning versus the afternoon and the evening. Also, something that comes up is if you get your lab drawn, if blood's drawn at a lab or at your doctor, especially if you're a doctor, labs are a little bit more careful about how they're handling the blood. But let's say you go to your doctor's office, get the lab done, and they put that blood sample out in the little old-fashioned metal mailbox type thing or milk box like that they put outside for the lab people to come and pick up, and it's sitting out there for several hours in the heat. That can dramatically change the impact of what the TSH test result is going to show up once it gets to the lab, which is, by the way, one of the benefits of our Paloma test kit, because once that blood hits that card and it is stable. It's not going to degrade. The sample's not going to change over time. So it's safe for you to put the card, pop it in your envelope, and walk it over to the mailbox later. It's not going to matter if it has to sit for a couple of hours before it goes in the mail, unlike a blood sample, which is going to have some dramatic changes. You can also have changes in your thyroid levels due to refills. If you're on a generic medication, every time you go to get a generic, the medication can be one potency or a different potency based on which generic manufacturer you're getting. So that can affect your levels as well. It also may be related to whether or not you've started or stopped a high fiber diet, or have you switched to taking medicine at night and you're having better absorption than you were having by taking it in the morning, or have you switched from a tablet to a drug like Tirosint, a liquid or a gel cap, which is better absorbed by many people and results in higher thyroid levels and lower TSH levels when they're taking it. So there's so many different factors. And so one of the things that we want to look at is, what did you get refills? Have you changed your diet? Have you started or stopped supplements? What are the other factors that go into it? But also, of course, most importantly is symptoms. If your symptoms have gone up dramatically with a 2.8 versus a 1.4, well, then that's a valid thing to explore. And then it's time to get in and talk to your doctor. Or in the case of Paloma, click on and have a virtual visit with your Paloma practitioner. So the rest of this question is, my levels were always 1.9 until 2020 when I started having symptoms, and my TSH was at 5.7. I'm not on thyroid medicine because my doctor said my levels are within normal range. I do take Paloma's Thyroid Daily Care and low dose LDN. Okay, well, this is an interesting situation because a 5.7 TSH is over the line and is considered hypothyroid. So there are some doctors, including some of our Paloma doctors, who in a patient that was symptomatic with a TSH of 5.7 would have a very serious discussion with that patient about whether or not they wanted to go ahead and treat them, because some doctors would treat that with a low dose of thyroid medication to get that person's thyroid TSH levels back into the reference range and relieve symptoms. So I think this person's question, I'm thinking another conversation with your doctor. And if your doctor's saying, look, we're just going to let you stay here at 5.7 with thyroid symptoms, I would be wanting, number one, to know if you had Hashimoto's antibodies, because that can be over time the cause of the elevated TSH and the increasing symptoms. But number two, if your doctor really isn't willing to engage with you, I think it's time to get a new doctor. So if you're not with Paloma, I'd say consider talking with a Paloma doctor because they're going to have a better grasp on how to handle borderline or subclinical hypothyroidism, which is generally where this falls into that category. All right. I recently read that it's better to have your blood drawn in the middle of the day instead of first thing in the morning on an empty stomach. Any merit to the afternoon testing in your experience? You know, I don't know whether there's any particular benefit. The TSH level is going to be a little bit different at different times of day. My best advice, always get it tested the same time of day. Because that, again, if you have your TSH run at 8 a.m. and the next month you get it done at 4 in the afternoon, that's not really an apples to apples comparison. So try to make sure that you're getting it within the same hour or so time frame, number one. And number two, always do it under the same circumstances. If you always take your medicine before you test, always take your medicine before you test. If you wait till afterwards, always wait till afterwards, because we don't want to have mixed situations time-wise or mixed situations whether you've taken your meds or not when you're going in for your blood work. Can you comment on how to switch from combo Synthroid Cytomel to NDT? Best approach? Best approach is, I mean, there's some formulas, and we'll be having some articles about this coming up on the Paloma blog, because it is a little bit of a complicated process. And there are some conversion charts, but they're not that accurate. The reality is your doctor's going to have to need to take a best guess estimate based on the percentage of a grain of natural thyroid that is T4 and T3, and try to find the equivalent match to what you're getting as far as your Synthroid and Cytomel, and start you off on that. And then from that on, you're off to the races, but it's trial and error. So you get rechecked at about 4 to 6 weeks. You adjust a little bit more, get rechecked again until you get to that sweet spot where the treatment is optimal, the levels are stable, and you're getting optimal level of thyroid hormone replacement. Okay, so we have somebody here. I did the AIP diet and my antibodies actually raised. They were 400 and now they've gone up to 1200. I'm no longer AIP. Okay, so the question there is something about that AIP diet may have been a problem for you. I mean, there are certain foods that you may have introduced into your diet that you weren't normally eating, or foods that you started eating a lot more of during an AIP diet that you have a sensitivity to, which can then increase inflammation and trigger antibodies. It may also be a complete coincidence. There, unless you then see a corresponding drop back down when you go back to regular diet, it's not completely scientific for us to say, yeah, definitely it was going on the AIP diet that increased your antibodies. You could have been exposed to infections that you're not even aware of. Your immune system could have been fighting off something. You could have some sort of chronic infection, even something like gingivitis, inflamed gums can change your immune system and affect your antibody levels. You may have had a gut infection. You may have, there's dozens of reasons why antibodies could go up and why antibodies go down. And so I'm not sure if claiming that it's the AIP is to blame is necessarily accurate. It may have been, and it may again have been something in the AIP diet food list that you were eating that was triggering a problem for you. I would say working with a good nutritionist or talking with one of our Paloma nutritionists or someone that's knowledgeable about the AIP diet might help you tease out where that fits in the big picture. My doctor said high antibodies are normal and wasn't concerned. I've read that high antibodies can be consistent with thyroid cancer. Well, first of all, high antibodies, they're not an immediate concern in the sense that it's not life threatening to you. You know, this is so we have to think about the way doctors consider something to be concerned about. High antibodies are a concern to me as a patient and a patient advocate because it tells me my body's in an inflammatory state. And I want to get my antibodies down as low as they possibly can be. I have Hashimoto's. I've had it for 30 plus years. When I was first diagnosed, my antibodies were in the 60s. Now they tend to run right around the edge of the cutoff line, about 30, 35, which I feel is good. And it may be the best it's going to get because I have taken low dose naltrexone, a medication which can sometimes help lower antibodies. I've done selenium. I do my daily thyroid care supplement from Paloma. I do all the things I need to get my antibodies down. And this is as low as they've pretty much gone. And that may be as good as it's going to get for me. But elevated antibodies have been in some very small studies associated with a slightly increased risk of thyroid cancer because it's inflammatory. Any inflammation is associated with an increased risk of cancers in many cases. So I don't necessarily agree with basically assuming, hey, antibodies are no big deal. Because antibodies can also make us more symptomatic. We can feel more inflamed. We can have more fatigue, more brain fog. It exacerbates and in some cases worsens any of the symptoms we have of hypothyroidism. That's why I really feel like the AIP diet component of our app and the information we have at our website and the blogs about autoimmunity, about how to lower antibodies, about things that you can focus on. We have an entire series of articles about low dose naltrexone as a tool for autoimmunity, and so much more to come. I mean, we've got articles in the pipeline research. Doctors are talking to us about things all the time about new ways to tackle the autoimmune aspect of hypothyroidism. So my preference as a patient advocate is take it seriously. It's not a dangerous, dire circumstance that, we need to rush off to the ER because my antibodies are high, but it's not something to be blown off either. It's something to be addressed, looked at, and taken advantage of. So I think we've come to the end of our first office hours, and this has been really fun. Great questions, everyone. I'm really thrilled with the incredibly smart questions that you all had. And stay tuned because we'll have some upcoming office hours and you'll get to meet some amazing Paloma doctors and experts, nutritionists, again, all this incredible people that come together to make hypothyroidism care their first priority and making you feel well and live well as their top priority. So stay tuned and join us again for another episode of Office Hours. And as always, come visit us at the Paloma Community. Check out our Paloma blog. Make sure you sign up for our new Paloma newsletter, which is wonderful. It's got some great information. It's coming out regularly with lots of updates and news. And we look forward to seeing you on social media as well. We're on all your popular spots. We're on Instagram, Facebook, etc. So come check us out, connect with us. We look forward to having an opportunity to get to know you all well. So thanks again for